Good afternoon. My name is Mercedes Guerrero. How would you feel if your child, your close friend, your family member was fighting a war that you couldn't see? Today I would like to inform the audience about depression and the right ways they can help people deal with it. Knowledge is power. You have to understand the situation and not blame the person for something they cannot help. To begin understanding depression, one has to know what it is. According to the University of Michigan Depression Center, depression is a real mental illness that impacts the brain. It is a serious illness that changes brain chemistry. Research tells us that other factors contribute to onset depression, including genetics, changes in hormone levels, certain medical conditions, stress, grief, or even difficult life circumstances. Now to speak of what depression is chemically in the brain. According to an article by Rick Newert, PhD, scientists believe that monoamines, which are mood-related chemicals, such as serotonin, norepinephrine, and dopamine. These are low in the brain during depressive episodes. Keep in mind that there are different types of depression. Beyond Blue organization has summed them up into three major and most common. The first is major depression, which is sometimes referred to as major depressive disorder, clinical depression, unipolar depression, or simply depression. It involves low moods and or loss of interest and pleasure in usual activities and as well as other symptoms. Melancholia is a term used to describe a severe form of depression where many of the physical symptoms of depression are present. There is also an illness known as bipolar disorder. It is known as manic depression because the person experiences periods of depression and periods of mania, with also periods of normal moods in between. Now that you have a better understanding of what depression actually is, this including knowing that there are different and more severe kinds, here are some tips to help you or someone you love cope. An important thing to remember is that depression is a medical condition. While being there for a person is important, it may not be enough. A quote from Jackie Golan, PhD, assistant professor at the Department of Psychiatric and Behavioral Sciences at Northwestern University. There are many things that you can do to support a person that has depression. First of all, treatment is key, and professional help is okay. Be active in their support and care. Talk about it. They need to know that you understand. They need to know that and understand that you care. Stay in contact with them and try to get them out of the house. This may be difficult at first, but fresh air and friends are good. Learn about depression itself. Encourage doctor visits and medication if needed. Pay attention. If things get more serious, they may need more help than originally thought. I had mentioned before that there are wrong ways to handle a situation when someone has depression. If you do not handle finding out when someone has depression the right way, it can be very damaging. According to an article on the health website, one of the worst things you can say and do is dismiss their illness and feelings. For example, there is always someone worse off than you are. Do not say things like, stop feeling sorry for yourself. This is something they cannot help, and you have to understand that before you can help. And let us review. Depression is a mental illness that impacts the brain. There are different kinds that can be more severe and need more attention. You can be there to help and support a person that has depression, but remember that might not be enough. They may require professional help, and that is okay. Do not dismiss their illness. It is as real as any other illness. If you do this, you could be seriously damaging somebody you love in unimaginable ways. I would leave you with this quote by Elizabeth Wurzel. That is the thing about depression. A human being can survive almost anything as long as they can see that there is a light at the end. But depression is so insidious and it compounds daily that it is impossible to ever see the end. The fog is like a cage without a key. Thank you. Are there any questions?
Is there any primary individual, old or young, that it actually affects the most?
I believe that it can affect anyone. It doesn't matter the age. It has to do more with genetics and other things such as their life.
You mentioned that certain things that we shouldn't do, and I think that we're all sort of guilty at some point if we don't understand what depression is. But you're saying that depression is an actual mental illness,
Yeah.
not just, I guess the way that I've always looked at depression as though it's just something that you're going through temporarily, but you've identified it as it being a mental illness. And did I understand you properly?
Yes. Yes, it is considered a mental illness. Now, I mean, life circumstances can contribute to being depressed for a little while, but
Mhm.
I mean, some people do need professional help and medication.
I had a question for you. So if you have someone that you believe is depressed and you say a few times that it's something that you shouldn't dismiss, what do you recommend as far as helping someone understand that they are depressed?
I think that you yourself would have to understand and learn about it, search the internet, books. There's plenty of books about it. So it would be very important to do that so you can help them understand it as well.
In your research, did you find where depression is could be a precursor to thoughts of suicide?
Yes, there were, if they didn't get the right treatment or if they weren't handling it well and basically were trying to deny it, suicide is something that could happen and they could probably be thinking about it a lot and it's something to pay attention to. We're good. Yeah.
Because like I said, that's good.